Hey, Misty here. I am now officially 2 weeks out from my Nuss surgery, which, if you haven't seen my former videos, so that is a surgery for pectus excavatum, or sunken chest, sunken rib cage. It's where they use metal bars to pop your sternum back out. You wear those for 3 to 4 years, and then you get them taken out again. So it's been two weeks. It's really hard to believe. Um, Sorry, I'm outside and I don't know if you can hear the neighbor's wind chimes. It's a little windy right now, but hopefully that's not too bothersome. So it's been a good 2 weeks, I feel like. I've seen a lot of videos on YouTube, and that's kind of why I wanted to make my own set of videos. They were super helpful to me before I had the surgery, just kind of like wondering what should I expect with all of this. For me, I feel like my experience may have been better than a lot of the videos that I watched, so I don't want to give like unrealistic expectations because everybody has their own their own recovery that they have to go through. But my surgery was with Dr. Jaruzelski at Mayo Clinic in Phoenix, and she's pretty much considered the best surgeon in the world for this, for adult pectus Nuss procedure. And that team is just so great. The team is so great. And they really have dialed in the pain management. And so for me, I had to have 2 metal bars in my chest. I think 3 would have been, more obnoxious, more painful probably. For the most part, they really don't do 1 anymore. They used to. I have seen other surgeons are doing 1. I've seen a lot of botched surgeries with just 1 bar. So if you are working with a surgeon and they're telling you just need 1 bar, I would get a second opinion, maybe from possibly a more qualified surgeon, because I think at this point here in 2025, pretty much all of the really experienced adult pectus surgeons are doing at least 2 bars. So that's my advice there. But as far as recovery is going, I would say for the most part, I haven't had real pain. I have had moments of like a little pain zinger that's not like super bad necessarily. But I'm not just like walking around in pain per se, or like laying around in pain or any of that. My back does hurt sometimes. I would call that like soreness, like different levels of soreness with my back. I mean, it does hurt sometimes. That's not necessarily from the surgery. It's more probably, well, I'll say part of it's from the surgery, because when you get the bars in your chest, you tend to have a bit of a posture correction. And so, the new posture that you have, and also just in trying to correct your posture moving forward, having better posture, you're going to have, a sore back. But I think also just when I'm like laying around too much on my back, that's creating more like pain or soreness in my back. But I do get some, they call them like pain zingers. I do get those occasionally. Usually it's in the right side. And also I get some pains, like yesterday especially, I started getting some pains more so like under my chest and kind of in the sternum area, I guess. I don't know if that's like just some things kind of waking up, because there's a lot of numbing done with the surgery. I don't know if that's things like just starting to wake up. I think also it could just be like if I'm hunching a little too much throughout the day, that bottom bar is probably pressing on some things more, in my body, and just not positioned as ideally as it could be if I were sitting up straight, and, keeping a straight back and all that. So I did do a lot more yesterday. I had to like go out to an appointment up in Tucson. Just had like more things going on yesterday. I sat and played board games last night with my family. I had a lot of people I kind of messaged with or questioned in forums or whatnot. And I was like, when can I play board games again? It seemed like it was going to be quite a while before they thought I would feel like I could do that, but no, it was totally fine. I don't think I would play, for if you're a board gamer, I don't think I would play anything where you have to do a ton of like reaching, because that might be uncomfortable. or even like a large puzzle where you'd have to like stand up at the table and reach, you know, and that kind of thing. I don't think I would really do that right now at this point. But like sitting and playing a card game or a board game where I, you know, kind of have like my own little space and I'm not reaching super far, that was totally fine. What else? So it does feel like adjacent to my numbed areas of my chest, kind of feels like I have rug burn almost. And I actually just posted that in one of the discords, and somebody else said, yeah, that's it, that's what I would describe it as. So I'm like, okay, it's not just me. So kind of right next to where all the numbed areas are, feels like it's not super painful at this point, but my skin just kind of feels like it has light rug burn type of a feeling. And even in my whole back sometimes feels a little bit rug burned. I don't know why that would be, but so it's like my shirt rubbing against that, and like all in my sternum. My sternum isn't really as numb because they do the cryo nerve freezing, you know, between your ribs, and I think that must just not really affect your sternum too much. Also, if you're having like nerve damage from where they do the incisions and move things around, and you know, I think your sternum maybe just, or maybe it's just my case, I don't know, but my sternum just was maybe less affected by the actual surgery itself, damage from the surgery. So I'm definitely feeling like I can feel my sternum, certain parts of my sternum better than others, I will say. So down a little lower, it's definitely numb there. But yeah, it's kind of a weird feeling, but it makes it really annoying, like where my shirt is, kind of under my armpits, you know, all that. Some other things. I did get a lot of swelling like a few days after my surgery. I had 9 or 10 pounds worth of swelling. I'm kind of a small person, so that looked like a lot to be like hanging around in my belly area, and kind of under my armpits. And so that was kind of alarming. Like I was expecting swelling, but I was like, oh my gosh, I have like this giant, like huge muffin top that was not that big before. So that has come down quite a bit. It's still there. And the swelling, it was so weird because some of it migrated down into like my crotch area. So like everything down there was swollen. And then I had a lot of bruising, particularly on my left side, which also went down into like it looked like I was wearing like a yellow diaper. Like, that's kind of starting to resolve now. And the bruising is almost gone. Then I also had a lot of like a itchy rash kind of thing going on. I think it started from a reaction to the adhesives because I had like a diamond where like a diamond shape where some of the heart monitors were, the sticky pads from the heart monitors. But also like under one of my adhesive bandages on my right side, I had like almost like a blood blister type looking thing forming right under the edge of that, and it was really itchy, and that was really first started. And then I don't know why it spread so much like it did, but it was like all up and down both of my sides, kind of across the lower part of my abdomen, and then I got this ring, like almost looked like a ringworm around my belly button. So it was super weird. Super itchy, super uncomfortable. That plus the swelling, you know, everything was just uncomfortable, but nothing was truly painful. Like, if I kind of press on some of the areas that were and are still swollen, yeah, like it hurts a little, but we're talking like a 0.5 on the pain scale. Like, so I'm saying hurts, you know, it's like, okay, it's low. Like nothing I've had for the most part has been over, I would say like a 3 on the pain scale. So, early days, I also had some pain upon inhaling, but like when I tried to inhale more deeply. And so like, you know, I had to be a little careful that I was intentional when I was inhaling more deeply and, you know, like ready for it, I guess. But it really wasn't above, I think like a 2 or 3. I mean, I'm terrible at these pain scales, but like out of 10 on the pain scale. And that resolved after a couple days. I did have some pains kind of, I want to say like at the bottom of my right lung, not much though, and like kind of in my back there. And I did have a pleural effusion. So when I went back for my 1 week follow-up, which was actually at like 6 days, they said, yeah, you have, so we did an x-ray. They said you have pleural effusion, which is like water around, like in the cavity, like the lung cavity, I think. So initially when I was like first like had the surgery, they had put a drainage tube in, so they kind of just drain that the first day that you're there, but then they take the drain out. So I still had some some fluid building up in the lungs. I think that's really your body's response trying, along with the swelling, your body's just trying to heal itself. And our bodies are a miraculous thing. Like, you don't have to just rush to get rid of all of these things that we perceive as negative. Because your body is creating, white blood cells and proteins and things to help heal itself, right? But you don't want it to get too far and then you have an issue or you're in too much pain to tolerate the problem. I really wasn't in pain from the pleural effusion. I actually was surprised that I had it a little bit because I thought it was super painful, and the pain is being well managed. So anyway, they did have me come back a couple days later to have some of the pleural effusion drained. So they said it wasn't super bad. There was more on the left than the right. And I think that's where I left off in my last video, actually. I don't think I did another video after it got it drained. So I guess I'll talk to that a little bit. So I went in, they did an ultrasound. They kind of like took me back, did an ultrasound to see how bad it was. And they kind of confirmed, like, yeah, it's a little worse on the left than the right. There's enough that warrants, like, let's go ahead and do it. But we don't think we'll get more than, like, 500 milliliters out, which actually sounds like quite a lot, like, if you think about it. I think that's, like, I want to say around 2 cups here in the U.S. So I was like, okay, let's do this, right? Well, they had sorry if that's loud. They had what do you call it? My brain is still like sometimes foggy from the gabapentin, I think, but not that bad actually. Usually, anyway, they had someone who's like doing like someone who's learning, right? Like a doctor who's learning, like going through the ropes, whatever. They had her come in to do the drain, and I think she was having trouble. Like, so they numb you at first with some lidocaine, and a resident. That's the word I was looking for. I knew it would come to me. They numb you with some lidocaine. She did that, and so then I wasn't really feeling when she was like trying to poke in there. But they did say like you're gonna feel it as we get deeper in towards your lung, and I think she was having trouble like finding where to go. They keep the ultrasound on so they can see like where the needle is it in the lung cavity in the right place, all that kind of stuff. And so they had to call in another doctor just to confirm, like she just didn't want to do something wrong, I think. And they were all very professional. Once he got in there and they got the needle in the right place, it's like a hollow needle, I guess, and they started draining things, like that did cause pain. Not gonna lie about that. So that was painful. It got to where all of a sudden, like, I felt a pain like shoot up in my back, like up towards my shoulder. And it felt kind of like when I have a pinched nerve that like creates a pain up in my shoulder. It felt kind of like that. And so I mentioned that. I'm like, oh, because I'm like, oh, yeah, like I'm kind of like holding back, like this is getting painful. And I'm like, I'm feeling that up in my shoulder. And he was like, oh, okay, that's where is a good place to stop. I can't remember why he said, but that's like where they would typically stop, is if you feel a pain like kind of shoot up higher, I guess, in your lung, or I guess that's probably a lung pain, but I felt it, felt like a muscle pain at the time. And so they stopped, and I think they only got like around 220 cc's of like stuff out of my lung cavity, which is not a ton, but it was like about a cup or so, I think we Googled it afterwards. And so anyway, that happened. It didn't feel great. It didn't take forever to go and do, but it is like a procedure where you could be back there for like an hour and a half to 2 hours if you're planning something like that. I didn't realize it was that long. I thought, oh, we're just going to pop in. It'll take like 30 minutes. We'll leave. No, it is a little bit longer. But yeah, so after that, I started feeling some little, like more little pains on the right side. And so I reached out to Mayo to see if there was anything like that might maybe have happened as a result of the procedure, because I thought it was probably just like a normal pain, especially since I did still have pleural effusion. Like they didn't get it all on the left side and they didn't do any draining on the right side. So I was like, well, maybe this is just like a normal pleural effusion / surgery type of a pain. But I want to make sure. So I reached out and they ended up having me go do an x-ray just to make sure. I just got the results yesterday and I haven't talked to Mayo yet, but pretty much there's nothing, new going on there. I think it really was just something maybe from the pleural effusion on the right side. And it did resolve itself after like 2 days. So I think we're good there. What else? I do still like feel the bars. Like I can feel, it just feels like a very tight band right across, like almost like the nipple line. Like feels like there's a really tight strap around right there that's just like holding me in, or like a, I don't know, a corset or something like that. And then almost like right under my breast. So pretty high up. Like I don't think the bars are very far apart. Maybe, I don't know, like that. They're not very far apart, I don't think. So that probably is right about where the bars are placed. I can't like touch them and feel them because they're under the ribs there. But I do have some swelling like under my armpits, kind of right where the bar ends would be, and those would be like possibly I would be able to feel those under under the skin there. And so we'll see. Right now it's all just swelling. Every now and then I think I might be feeling like a bar or something right there when I press in on it. But yeah, that's kind of where we're at. I'm at the 2-week point. I did start kind of weaning down on the medications a little bit as of yesterday or last night. So I was doing a lot of the meds like 4 times a day, and now starting last night and today, I'm kind of at 3 times a day now. And then I think once I know I'm okay there, I'll reduce some of the meds, like the Tylenol. They have me on 1,000 milligrams each time. I might try 500 and see if that does it, that kind of thing. But yesterday I did go. So I was used to taking some things like every 6 hours. I went probably more like 10 hours in between doses. And actually I was kind of okay. Like I wasn't like as well pain controlled as I have been. Like I was starting to feel it, right? Like end of day, it was like 11 o'clock. And that was when I wanted to take my next dose and, start my every 8 hours thing. And I was like, yeah, I'm definitely like more sore. I'm feeling it. It's harder to, crunch up to get in and out of a chair or like get in and out of bed, that kind of thing. But it was still like tolerable and surprisingly not that bad. So doing really well there. I don't want to make it sound like this is just like easy, because it's not. And recovery is going to have its ups and downs. Like I may be telling you a whole different story when my cryo nerve racing starts to wear off in another 2 to 4 weeks. Like it might be a whole different story, right? But today and the first 2 weeks, I am shocked at how well it's been going. My daughter is scheduled to have this surgery 1 week from today. It's super crazy to me. She's like my tiny little 13-year-old. And she might have a whole different story. I kind of thought that she was going to be the one coming out of surgery and like everything would be kind of almost like easy for her compared to my recovery. And I hope it is, because that would be just amazing. And I think that my recovery not being like super crazy hard has been encouraging to her. Like it's helping her not to be so afraid to go and do it, But I definitely, I hope, I know that her story will be different. She'll be on different medications. She's going to a different hospital, still very, highly acclaimed and all of that. Great surgeon, all of that. But, she just might have a different experience, and I'll be here to share it, I guess. But yeah, be sure to ask questions below if you have them. There's so many things I keep pondering, should I put in this video or not? So many things I want to talk about, but I kind of want to, and maybe I'll just do some separate FAQ kind of, or a question and answer type of video separately from just overall recovery. So yeah, do let me know if you have questions below. I know this got kind of long, but I want people to hear my story, because everyone's story is different and you need to kind of hear them all. Definitely, if you are considering this surgery, get into the pectus excavatum forum on Reddit, and you'll find a link to the Discord as well. Those are some really great starting points. There's a Facebook group, pectus excavatum group, for women specifically, if you want to just go where there's just women, and talk about it there. And you're going to get different kinds of questions and answers there than what you see where it's largely men and everywhere else. There is a Dr. Jaruzelski Facebook group. It's not her group, it's someone who had the surgery with her created the group so other patients could chat with each other and whatnot. So you're going to find people who are about to have surgery and who just had surgery, specific to Dr. J and the Mayo experience. So yeah, go out and seek out that information, watch videos. If you're the type of person that it helps you to know more and see more, Dr. J has a video of her doing the surgery. It's not quite as recent, so some things might have changed, but for me, seeing her do her work and talk about it during the surgery, talk about things that were coming up during the surgery, gave me even more confidence in her. And I already knew she was amazing, right? But gave me even more confidence in the surgeon that I was choosing, because I saw how she responded to things and how confident she was about things and how thoughtful she was about how she was doing things, and just how much care she puts into her patients and her procedure. So yeah, go do, if something like that though, if watching a surgery is you're that would freak me out and I would never do that, and that would scare me and I wouldn't want to get it done, right? Then don't watch those videos, but go get information, inform yourself, know what you're getting into. And I want to just preach this till the cows come home, because I'm seeing so many posts lately, and I'm sure this is just constant all the time. It's just I've been more active in the groups over the last few months, seeing so many people who are having this surgery with a surgeon who sounds confident, but in the end, their surgery's been botched in some way. They're in extreme pain, or their chest is still caving in a bit and it's not really corrected, so it's you just went through that for nothing. Or the bar is they only got one bar and it's not positioned right. It's maybe their bar's flipping, that kind of thing. Sorry for the dog noise next door, but yeah, and all of that is completely avoidable if you go to a surgeon who has actually done this surgery hundreds or thousands even of times and knows what they're doing. They know the current practices and all of that. So anyway, it's getting a little noisy out here, so I'm gonna go. I know this got long, but yes, please put your questions below and I'll be happy to do separate videos on those questions, and I'll keep posted as my daughter has her surgery and as my recovery keeps coming along. All right, bye.